There is this business philosophy out there that an organization should be run like a machine, which is to say that there should be no irreplaceable people, but rather individuals who fulfill certain interchangeable roles such that the organization continues regardless of who's at the switch. And that may work for some companies, but it's not the way that we run our organization at Parker Cornea. The beauty and the wonderful thing about working, I think, in my job is that all of the people around us have got so many skills and abilities that I don't have. And that when people leave, it's really tough to replace people who are unique, who have amazing skills, and who bring things to the table that you just don't find growing on trees, And one of these amazing, unique people that we've been lucky enough to attract to the practice, I think, is our new incoming fellow, a guy by the name of Philip Dockery. Dr. Dockery is somebody I've known for 10 years. I knew him when he was a medical student and then during his research fellowship in Philadelphia with Dr. Carol Shields, and then internship and residency. And we're so happy to announce that he's going to be coming back and joining us at least over the course of this next year as our fellow. I remember working with Philip 10 years ago. He and I were operating together. We were doing corneal transplants together when he was a medical student. He was doing these complicated cases like nobody I've ever seen before. And it's such an amazing, special thing, actually, now 10 years later, to be able to attract him back to work more as partners on doing these complicated cases. So this video that you're about to watch is a Philip Dockery video. It's the first of what I assume will be many videos that he'll be making on some of the amazing, complicated operations that he does and the unique things that he brings to the table. So I hope you enjoy this video, and I hope you enjoy learning from him over the course of the next year as much as we anticipate learning from him over the course of the next year. So thanks so much for watching. I hope you watch a lot more.
Hi, my name is Philip Dockery, and I'm one of the ophthalmology residents at the University of Arkansas for Medical Sciences, and today I'm with Parker Cornea in Birmingham, Alabama. We'll be talking a little bit about CAIRS, or corneal allogenic intrastromal ring segment implantation for the treatment of keratoconus. We first mark the cornea with crosshairs, and then we put a little ink right in the middle to help us determine the center of the cornea, and then we mark the peripheral cornea so that we know where to place the segments. We then with a guarded diamond blade, make a radial incision at approximately 70% depth of the cornea that we determine with Pinacam prior to the surgery. We then use a vacuum suctioning device to help us hold the eye in place while making the semicircular channels. We open it up a little bit with a pocketing hook and then rotate the blunt dissector through those semicircular channels. And you may notice the incision isn't exactly temporal, as it is in some cases. It's a little bit off axis. That axis is determined preoperatively on Pinacam based on the areas of most steepening so that we can apply the segments in the areas to provide the most optimal flattening for these patients. After we bluntly dissect to create these semicircular channels, we then prepare the CAIRS segments, which are prepared in an eye bank using albumin to help stain the graft slightly yellow, and then they're dehydrated to help with assistance of moving the graft into the channels. We trim the segments and then start implanting it. The segments should slide into the channels fairly easily without too much resistance. In this case, we're putting in one segment, but in some cases we may need two segments, depending on the topography prior to the surgery and where we may need to have flattening. When one segment's applied, a suture most commonly isn't needed to close the incision, but when we have two, we almost certainly will need an incision. In this case, after the first segment was implanted, the case was completed. Thanks for watching.